I was diagnosed with prostate cancer the month of December of 1999. The side effects come with the surgical procedure, I mean post-operatively. And there are two main side effects that we males have to contend with, and that's incontinency and impotence. And of course, depending on your age level, younger fellas probably won't have too much of a problem. I was 70 when I had it done, and I have no incontinence problem. The impotence is there, which is a little frustrating, but you cope. So you have to have a partner, of course, who is certainly understanding, and I'm fortunate in that respect. My wife and I we had our conference with this first urologist who explained what to expect. So following the surgery, of course, she knew this was in all likelihood would happen. And so you just compensate. We're still affectionate, but we just can't have intercourse. I'm not out crusading or anything like that, although I will, if I ever hear some guy saying, well, it's been 10 years since I've had a physical, I get a little, not upset, but I try to tell them that it's important that they do because, but it makes you more aware, I guess, and you can empathize with men who say things like that they haven't been checked, or they're having prostate problems, or that your antenna is out. You sort of pick up on these things, and sure, I try to talk to them if I can. My wife and I are trying to do a few more things together, traveling and this sort of thing. Even though we can't afford some of it, we do it anyway, as long as we can still walk and take nourishment. We're going to do these things, and we try to spend as much time with the grandkids as we can, even though they're not here, but they're up in the LA area. I think it makes you more aware of doing what's better for you. By that I mean eating the right foods and getting more exercise, and these things take on a little more importance, I think, in one's list of priorities than maybe they have in the past. Because in the past, if nothing's wrong, you think you're indestructible, like some teenager, nothing's going to happen to me. But we're all very frail, and you never know when something's going to pop up like that. So I think it makes you more aware of doing the right things and maybe taking care of yourself a little better. My name is Brice Lockwood, and I'm a 5-year prostate cancer survivor.